So how do we know if the treatment is working or not working? Well, we measure not the amount of the tumor cells themselves, they're in the bone marrow, you can't get to them. We measure the product, that antibody marker. Does it go up? Does it go down? So we measure that in the blood and the urine. So most patients have it in their blood. Sometimes about 15% of patients only have the protein in the urine. It's just part of the antibody. But we now have this newer assay, the serum-free light chain, so we can do that measurement not only in the urine but the blood as well. So when we measure that reduction in protein, we call those certain degrees of response. If it's 25 to 49% below where you started, it's a minimal response. 50 to 89%, partial response. 90%, but not all gone, a very good partial response. And if that marker disappears completely, we call that a complete response. The urine numbers are done a little differently. At least 50% for a minimal response, 90% for a partial response. These days, it's fairly common for patients to respond to some degree, and many patients achieve complete responses. However, the achievement of complete response, disappearance of that protein marker, doesn't mean the patient's cured of myeloma. It certainly can come back in time. The good news is today there's so many options. So when it comes back, when do we say, okay, it's progressing? If it goes up by more than 25%, we say you're progressing. We also want to know if it's not being well tolerated. Are you feeling crummy on it? Are you tired? Are you having pain? Are you nauseated? That may make us want to change therapy or at least reduce the dose. How's it impacting your blood counts, your kidney function? That also may lead to changes in the dose or schedule of the drugs as well. So it's not necessarily all about, is the disease getting worse or better? It's also how you're feeling on the treatment. Because today there are a lot of other options that we didn't have simply a few years ago that you could try if you're not tolerating the present therapy well.